Hello everyone, my name is Dr. Priyanka Saokar Navale. I'm owner of Deccan Dental Clinic. My clinic is located in Pune on FC Road. So today I'm making this video especially for the patient who asked me whether extractions are necessary. Extraction of any tooth, whether it is deciduous, permanent, are rarely advised by the dentist. So if it is advised by a dentist, there is a certain reason behind it why dentists want to extract that particular teeth. Most commonly advised extraction is of wisdom teeth, where we usually advise patient to remove their wisdom teeth if it is not erupting into the oral cavity. That time there are chances that wisdom teeth might damage to the adjacent teeth, that is second molar, and in such cases we advise patient extraction. Sometimes we advise wisdom teeth extraction when they are not able to erupt into the oral cavity, as well as tissue above the wisdom teeth is getting infected frequently and patient is having too much of trouble with the coping up with those pain, that is known as pericoronitis. In such cases we advise extraction of wisdom teeth. Sometimes permanent teeth we advise extraction. In such cases those teeth are in very compromised condition, like there is a severe gingivitis which has caused periodontitis and which led to too much of infection, or when the tooth is in degraded condition where the crown is broken and root part is brown and we cannot even restore it with the help of root canal treatment. In such cases also we advise patient extraction. Sometimes we advise them to extract the teeth if it is impacted inside the bone and causing resorption of adjacent teeth and there is no place for that permanent tooth to erupt into the oral cavity. Sometimes for such cases we advise extraction. Another thing, if the tooth is associated with some lesion or tumor into the oral cavity, in such cases also it is advisable to extract that tooth along with the lesion associated with it. So these are the common reasons when we advise patient extraction. Otherwise extraction procedure are not generally advised to any patient since it is an irreversible process. We always advise it with a caution. So hope this clear your doubt about whether to go ahead with the extraction of your tooth and which tooth you are actually planning to extract. Thanks for watching. Bye bye. Take care. Thanks for watching. Type yes if you found this video helpful. Have any questions, drop them in comments below and we will get back to you as soon as possible.